From Flourish DX, this is the Psych Health and Safety Podcast. With workplace mental health becoming a safety prerogative, this is the source of information on psychological injury prevention and health promotion.
Hi, everyone, and welcome to Psych Health and Safety Canada. I'm Kim MacDonald, and I'm your host today. If you've been here before, you know what the podcast is all about. But for those who are here for the first time, the podcast aim is to raise awareness and understanding around psychological health and safety as a strategy and management approach to positively impact mental health by looking at workplace factors, psychosocial risk factors, as well as the work conditions and work design, and to also strategically help people understand about mental health in the work and what is actually impacting mental health beyond the individual. And this is all psychological health and safety is at the organizational level. And today, my guest is Dr. Leah Ringwald, and I'm excited that she's back again. We chatted last year in the first phase of the Conference Board of Canada's study. And today she's here to tell us about this, the second phase. And the second phase really is exciting for workplace leaders across Canada. And leaders, we are always trying to figure out the best information to be able to inform our leadership practices. And this study is particularly relevant because it's Canadian and is a very deep and rich study. So Dr. Ringwald, thank you for joining me, and I'm excited you're here.
Hi, Kim. Thank you so much for having me.
I'll give a little bit of an introduction to you.
Sure.
And then we'll just dive right into the questions and the study. Dr. Ringwald is the Associate Director of the Human Capital Knowledge Area of the Conference Board of Canada, with a background in organizational psychology and a passion for the work and the employee experience at work. Dr. Ringwald leads research conducted through the board's Workplace Mental Health Research Center and oversees various projects under their Workplace Inclusion Knowledge Area. And which is it's so exciting to be able to talk to you again and to be able to talk about this particular study. And today I'm going to try to make sure that I'm listening and just nudging all your as you go through the study, because I know there's a lot to cover and lots that we can get into and chat about. So maybe the best place to start, Dr. Ringwald, is to share a little bit about the previous phase one, and in that way we can then flow into phase two and the findings that you had.
Sure. Yeah, that sounds good. So I know we touched on this last time we spoke, and we were really excited about phase two data coming in. So really excited to get into the national survey piece. But the program itself developed from a need to better understand how the evolving work context was impacting social connections and mental health. And we knew this was a really important area to dig into because we saw in our benchmarking research last year that almost all Canadian employers that we had surveyed were offering the possibility of working from home for at least some employees some of the time. And we know that hybrid arrangements are the most prevalent arrangement across different industries and sectors. And then on top of that, we were hearing concerns from HR leaders, so both in our executive councils and through our surveys, around remote work and whether it was impacting connection building at work. And then, of course, whether that translated into mental health outcomes. So if you recall, in phase one, we did a pretty extensive review of all the latest research. And basically, we were able to confirm the positive outcomes of social connectedness and then the negative impacts of loneliness on business outcomes. And that's pretty well established in the literature. We know that socially connected workers are more motivated. We know that workplace relationships are really crucial for productivity, and that loneliness has significant effects on health and well-being. And then, as you alluded to earlier, the Canadian research on this topic is actually very limited. And on top of that, a lot of the research that was done around remote work and health outcomes was conducted either before the pandemic or during the pandemic. So we really didn't have a good sense of how things were functioning today. And so yeah, to better understand the scale of this issue in Canada and the associated costs, we knew that we could help organizations and leaders determine how much they should be investing in programming and interventions. And so that's really what drove this second phase of the research, where we basically set out to collect and analyze national data and get that employee perspective to look at the relationships between social connection, mental health, and all of the factors that are at play there.
That's amazing. I'm always excited when we can take conversations around mental health and business outcomes, as well as the human impact, and then look at the latest information we have. And it's interesting that look back and we think, oh, the pandemic was a few years ago. It's always amazing that we now can have new information for today.
Absolutely.
Yeah,
Yeah.
because the situation was different, and there were a lot of different contextual sort of factors happening. And it's nice to get this and see how people are feeling. What are they experiencing today?
For sure. I mean, we're still feeling the aftermath of the pandemic, but so much has changed and we've evolved so much in terms of how we work. So it's important to look at how things are going now.
Great. Can you, so this particular phase, looking at its, what is the research question or what is the purpose, and then how you went about it?
Yeah. So we had we had three main research questions for the program of research. We wanted to understand to what extent social connections influence employee mental health and business outcomes. And we wanted to understand if this differed by certain employee groups as well. And then what organizational level and team level strategies were effective for building social connections at work. And then what types of supports do employees need regarding social connection building at work, and how do those needs differ by group?
That is great. Could you define social connection
Yes.
for, yeah,
Yeah, it's a great question. So, in this national study, we measured it in two ways. So, the first measure was workplace isolation. So, this focuses really on the availability of social support and the presence of functional relationships at work. So, the items we used in the scale were really asking employees if they had coworkers they can turn to for practical help or day to day conversation. And it's really more about whether an individual has access to social resources and connections at work. And then workplace loneliness, that's the subjective feeling of disconnection and emotional isolation. So it looks at whether employees feel emotionally distant, alienated. Are they lacking meaningful relationships at work? Because we know that even if you have access to social resources and you could be sitting in a room full of people and have your coworkers surrounding you, but you can still feel lonely. So that second scale really captures the quality and the depth of social connections. And it was really important for us to look at it in these two ways because it helps organizations to better understand not just whether employees have access to those connections at work, but whether those connections are actually meaningful and fulfilling.
Would it also, thinking about someone in that group, um, in that meeting, the other kind of conditions and the factors that may or may be making the person feel isolated? Did you get into some of that in this study or in some of the background research you did?
Yeah, for sure. We measured all kinds of things, all kinds of factors that when we did our scan of the research, we knew were drivers of connection and isolation. So, a good example is how often people interact with each other at work or socialize at work. We looked at frequency of meetings with their leaders. So, a lot of aspects that are at play, like you said, that can influence these feelings of connection.
For the maybe to make sense, that physical proximity and the question you raised, which is how maybe leaders are thinking about that you have to be in the office, or still having that lingering, even if they have a hybrid or remote situation. Could you share a little bit about that? About I guess some of the findings you had in those three questions.
Yeah, so it's interesting. when we started out this study, we came across all kinds of articles that were linking remote work with loneliness and isolation. And when we dug into the evidence to support that association, it was really inconsistent. Um, and, we're a few years out of the pandemic and we're seeing this debate around return to office. And I'm sure, Kim, you've seen in the media, there's a lot of large Canadian and US organizations that have been calling employees to come back to the office. I know Amazon made a lot of headlines. It ended its hybrid work policy and asked employees to come back 5 days a week. And then in Canada, we saw just this last September, the Canadian federal government asked employees to come back 3 days a week, and it was up from the required 2 days. Um, and so this return to office debate really sparked a lot of questions for us, because a lot of the rhetoric around it was often around themes like we want to foster collaboration and innovation, we want to strengthen employees' connection to organizational culture, and things that they were stating were allegedly more difficult when employees are not sharing the same physical space. So this really emphasized the relevance of the questions we're trying to answer in the second phase. Because by looking at the association between work models and social connections from the employee perspective, uh, we were yeah, so the context really emphasized the questions we're trying to answer in the second phase of the research. By looking at the association between work models and social connections from the employee perspective, we were hoping to be able to provide evidence-based insights to help organizations better navigate those decisions around calling employees back to the office.
So, we wanted to understand first whether people working in different work models are more or less likely to interact and socialize with others at work. And when we say interact, we mean, are you interacting casually with people at work or interacting through work related meetings and collaboration? And probably not very surprising to anybody, but we found that remote workers do spend less time interacting with colleagues than those working in person or hybrid. And then we see the same picture when we look at time spent socializing with coworkers. So those working in person are more likely to spend time socializing with others than their counterparts in remote work environments. And of course, that makes a lot of sense to us. If you're working fully in person, you have these opportunities to have face to face interactions with your colleagues. And that, of course, can facilitate really spontaneous conversations. And then, in contrast, working fully remote, you lack those opportunities to have casual conversations with colleagues. So it makes socializing a bit more intentional and less frequent. Um, so, given that our data confirmed that fully remote employees have less opportunities to interact and socialize, we expected that these differences would have an impact on their reported feelings of connection. Um, so, in other words, the differences we see in interaction and socialization frequency would translate to differences in isolation and loneliness. But what was super interesting about our research is that when we tested the direct effect of work model, so looking at remote, hybrid, and in person work, we saw no difference in reported workplace loneliness and isolation. So, really, what that tells us is that it's not the work model that's as important as what's being done within those work models. And that doesn't necessarily mean there aren't specific challenges within each work model, but that there's other factors that are influencing these outcomes around social connection.
Okay. Can you share a little bit more about that?
Yeah, so it's interesting that 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 finding surprised us, and of course we wanted to dig into it a little bit more. We scanned the gray literature, and some authors argued that the negative effects of the shift to remote work during the pandemic didn't really have much to do with the intrinsic characteristics of remote work, but it was the fact that this shift was sudden, and most of us had no input or no say, and we weren't really well prepared for it. So we wanted to look into work model change. And what we found is that those whose work models had changed in the last year were more likely to feel lonely and isolated. And this is interesting, especially when we look at the data that shows 80% of the employees who reported a recent change in work model actually reported an increase in in-person days. So they were asked to come back to the office more often, not the other way around. Yet they
Okay.
were reporting more loneliness and isolation. And then we saw the effect of change on other key outcomes like engagement. Um, so clearly, changing work models requires a lot of attention and careful consideration, just like any change in general. And we also asked participants, if your work model changed in the last year, did you have any input in that decision or was it decided for you? And we saw that employees who had no input in their work model change were more likely to feel lonely. And probably not surprising, they were more likely to experience stress and think about leaving their jobs.
Okay. So there's a potential for a big business impact.
Definitely. It really points to giving employees voice. And I'll come back to that because that theme kind of emerges in a lot of our findings, really listening to employee needs and trying to align decision making with what employees are asking for. Um, we also asked hybrid workers because hybrid, like I said, is such a prevalent work model. We wanted to do a lot of extra analysis there. So we asked hybrid workers, do you have the autonomy to choose what days to work remotely versus in person? And we found that reported loneliness and isolation was much higher when organizations determined which days their employees were to come into the office. So in other words, employees who had the autonomy to choose felt less lonely and isolated. And then a not very surprising finding was that workers who could choose the days that they worked remotely and in person also experienced less stress. And one more thing about autonomy that I want to point out. We've been talking about flexibility as to where people do their work, but another really important aspect of work arrangements is the flexibility around time and when you work. And we started to see some really interesting differences related to work models when we looked at this particular aspect of flexibility. Um, so our data showed that across all work models, having more schedule flexibility was associated with lower loneliness. And then on top of that, a lack of flexibility had greater impact on loneliness when employees worked remotely compared to in person. So, yeah, having that time flexibility, I think, is even more important when you're working remotely. It's a kind of a perk that you expect when you work outside of the office. And then we saw a really similar pattern for outcomes like work engagement and mental health. So, really, what all of those results really they underscore the importance of providing autonomy and flexibility in the work context, and that's really consistent with what we see in the external research that shows the positive effects of remote work are really contingent upon the level of autonomy that people have.
Do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the FlourishDX Academy. www.45003.org. Now back to this episode.
Maybe you can. I know this is on the theoretical side, Dr. Ringwald, but it's sort of around that idea of self-determination and the value of that. Maybe share a little bit about that, to dig a little bit into what autonomy means, and as humans, as I guess adult humans right now in the workplace.
Yeah, I mean, I think it comes down to the classic case of adults want to be treated like adults and they want to have autonomy to make decisions that work best and fit best with their life. We're seeing a lot of this push for more work life integration where employees have more control over how and when they work so that they can properly integrate work life balance. And we see a lot of caregivers in the workplace have to attend appointments or they have other obligations, family obligations that they want to fit around their work schedule. And allowing them to do so has a lot of benefits. And when you look at business outcomes, because those employees, when they're able to fit their responsibilities around their work, and they've got the flexibility to do so, they're able to show up and work and really thrive when they're there. Yeah, so just to kind of wrap up, s- uh, you mentioned self determination theory. I mean, it's highly relevant in the workplace because it helps us to better understand motivation and performance and well being and how to optimize those things by addressing the psychological needs of employees. Um, and by better understanding that, organizations can design work environments that really empower employees and of course, then enhance both the individual and organizational outcomes.
Great. Just maybe, and as you were looking at it from a leader perspective, what I'm hearing you say is around that the importance of the leader behavior. What are maybe just go down that sort of path a little bit on what the findings told you in terms of that, how important that is.
Yeah, leadership was a really interesting finding. So we looked at inclusive leadership, and I'm just going to uh, explain how we measured that. So, we asked participants about their supervisors and managers, and we asked them the degree to which they perceived them as available to provide support and guidance. And we called that accessibility, and also how they perceive their leaders' ability to listen to them and create a psychologically safe work environment. And we called that openness. And those two dimensions are really what we fall under this concept of inclusive leadership. Um, and so our findings suggested that inclusive leadership can help to reduce feelings of isolation and loneliness across all work models. Um, and that employees who reported that their leaders were inclusive felt less isolated or lonely than those who rated their leaders as less inclusive. And when we looked at this relationship across the three work models, the data showed that this inclusive leadership is actually especially critical in reducing isolation in fully remote work environments and plays a crucial role in mitigating loneliness in both hybrid and fully remote models. So, I think when we look at hybrid and remote contexts where those opportunities for social connections are limited, leaders really become this primary source of support. We know that targeted training programs that equip leaders with the skills needed to address challenges effectively are very important. Programs that help leaders develop those essential skills to manage loneliness and isolation can increase their knowledge of mental health issues and help them recognize warning signs of mental health challenges, and then, of course, develop their strategies for offering emotional support to employees. And another thing we looked at, I mentioned this at the beginning, is we looked at meeting frequency as a kind of a driver of social connection. Um, and we found that employees with who were satisfied with the frequency, so how often they were meeting with their supervisor and manager, reported lower levels of workplace loneliness. So it's hard to really define what we mean in terms of like what's the recipe for satisfaction with one-on-ones. It's really up to the employee's preferences. So there's no one size fits all frequency. But we did when we analyzed the data, we found that employees are more satisfied when these meetings occur at least every 2 weeks.
Every 2 weeks is certainly doable.
That's
That's my,
right.
yeah. In terms of, if you're working remotely, I think that's, I think for most leaders, Canadian leaders, that's as a boss and as a supervisor, that seems like a very, very easy component to be able to
Right.
make sure that you have that kind of practical behavior,
Right. I
just
mean,
to
I would
set that up.
argue weekly is probably optimal, but
Me
again,
too. Me
it's so
too.
important to check in with your direct reports and ask them about their preferences because it can be a delicate balance. Employees want to feel connected, but they also don't want to feel overwhelmed by excessive meetings. And that's the other kind of pain point we hear about with remote workplaces is that it's really increased the amount of meetings, of virtual meetings that folks have to sit through. So, I think with one-on-one meetings with supervisors, it's an opportunity to kind of revisit this topic, check in with your employees and better understand what their needs are, and then adjust the cadence around that so that you can maintain alignment with your employees' needs. And if you're checking in often, those needs might change. So Um, Another way is if you have a large team, maybe conduct a quarterly pulse check with employees, just to gather insights on their meeting preferences and ensure that your meeting are continuing to meet their needs as they change.
Dr. Ringwald, did you explore the content of those one-on-ones, or is that, sort of the content quality versus the frequency, or are they two completely separate things, I guess?
Yeah, I mean, they are two separate things. We didn't dig into the content of the meetings, just I mean, one-on-one check-ins typically, from what we hear, it's to check in on the work, to check in on how the employee's doing, but we didn't specifically ask anything around this in the survey.
Did you explore that it's more task oriented versus relationship building oriented?
We
Those two kinds
didn't.
of, okay.
Yeah,
Because in the literature, I know that there's, lots of good guidance there for both of those, obviously, from a workplace are important. And sometimes in my experience working with clients, the default, and it's easier to be very task oriented and objective, the work objectives versus the other piece, which is, helping to understand the employee needs, building a relationship with them to, really get to know how they like to work, and to be able to work effectively has those relationship components.
absolutely. Yeah. And there's a lot of different tactics that you can use to better understand that. Like our team has a team blueprint, for instance, where it's a questions that employees can answer about how they like to work, when they like to work, how they like to receive feedback. And that's such a good tool for a leader to have, but also your colleagues to have to better understand how to work with each other.
Yeah, because sometimes, I mean, it's that idea of being explicit, the
Right.
explicit communication, what do I need and how do we work together and what's my role in the team, or to you, and my accountability and responsibility, and what's yours to me. So I think I'm loving hearing some of this, which really gets kind of shifts the idea of a manager, in what I'm hearing from some of the findings you've had.
Absolutely.
Jumping into some of the other key areas, and maybe it's just so I'm gonna or just to reflect and not summarize, but so loneliness, inclusive leadership. Were there other themes that, if you could categorize some of the themes in the finding?
Yeah, I mean, I think the key theme that emerged across all of our findings is this idea of voice and choice, or what we like to call voice and choice. So it's really giving employees autonomy over different aspects of their work. Um, we saw that offering schedule flexibility and autonomy as your operational needs allow. Of course, it's not always easy depending on the type of work you do or your organization, but being able to provide at least some can foster social connection and engagement among employees. So it's such a critical piece of the puzzle. And flexibility doesn't have to mean fully remote work or hybrid work arrangements. It can include things like compressed work weeks, which we've seen in the research have had a lot of really positive outcomes. You can provide extended lunch breaks for personal commitments, or the ability to occasionally work from different locations. I think we're seeing in the research that employees really appreciate this perk. So, the last thing that I want to emphasize too is around clarity. And this came up a little bit when I was talking about changes in work models. So, when you're making changes to an organization's work model, uh, organizations need to be really clear on what aspects of the arrangements are negotiable, uh, and then which are not up for discussion, because having this clarity allows employees to voice their preferences and also allows leaders to act on aspects that are flexible. And then it also helps to avoid opening conversations where employee input may be ignored. So, for example, when you're implementing hybrid work models, find ways for employees to choose how many days they can work remotely or in person, if this is possible, of course. And then regularly assessing employee feedback on work model preferences and experiences. So you can do that through engagement surveys, pulse surveys, and involving employees in ongoing discussions is a really great way to foster trust and buy-in. On the flip side, if you're not clear about what aspects you're not able to change right from the beginning and employees provide input on that, they'll have this false sense that their input is just being disregarded and maybe they don't understand that that's not a possibility from the beginning. And that's, has the opposite effect. That can break trust in senior leadership and reduce buy-in. So I think that's an important point that organizations and leaders can have in their pocket.
Yeah. I mean, obviously, securing and maintaining trust. We know from the research too that that has so much impact, and there is, it's a complex, it's a complex issue inside organizations. Well, that you've given us a lot to think about, and we can have. I'm going to put Dr. Ringwald. I'll put the links to these studies in the show notes. Do you have any final tips or advice for organizations as they take a look at the study and the findings?
I would say, really the key finding here is to better understand how we can provide employees with more voice and choice and help enhance their feelings of social connectedness. And that can influence mental health outcomes and business outcomes. So there's a lot of really good practical examples and recommendations in the full report. So I encourage everybody to read through that. But really, it's about deciding based on your operational needs, where can we, first of all, how can we collect data to better understand employee preferences? And then how can we act on that data in a timely manner and kind of meet these needs for more flexibility and voice and choice in the workplace?
Thank you, Dr. Ringwald. That is awesome. Looking forward to lots of people checking out the study and taking it into their teams and working with it. And as they try to improve psychological health and safety strategies or their programs. And thank you to our listeners. Please like, subscribe, and follow the podcast. Share this episode and others with your colleagues. And please come back. And there's a whole host of different topics and podcasts there for you, episodes for you to enjoy, find out more, learn more about psychological health and safety and its impact on mental health and well-being. And thanks to Flourish DX, the amazing organization that sponsors and helps this podcast come to listeners all over the world. Thanks, until next time.
You've been listening to the Psych Health and Safety Podcast. To stay up to date with the latest on psychological injury prevention, follow Flourish DX on LinkedIn and subscribe to the Psych Health and Safety Podcast at www.psychealthandsafety.com.